Hello and welcome. My name is Sarah. I'm a newly qualified speech and language therapist. I've been studying at De Montfort University in Leicester. Welcome to my roundup of the National Trans and Gender Diverse Voice and Communication Clinical Excellence Network, otherwise known as a CEN. Cultural competence was one of the main themes of the day. This started off with an activity around labels, where in small groups we had to discuss labels that we had been given ourselves and labels that we would self-identify with. It was really valuable to listen to other people and hear their perspectives on some of the labels that they'd been given, and also to identify the shared experiences that we all have. In the discussion around cultural competence, the comparison between the term cultural competence and the term cultural humility came up. Cultural competence is the ability to provide care to patients with diverse values, beliefs and behaviours, and tailoring healthcare delivery to meet patients' social, cultural and linguistic needs. In essence, it is the ability to interact effectively with people of different cultures and address health inequalities. Cultural humility incorporates a lifelong commitment to self-evaluation in order to redress the power imbalance in the patient-clinician dynamic. Discussion about these two terms brought up some interesting points. The term cultural competence and that word competence implying that there is a finite amount of knowledge that one can acquire around different cultures. However, our knowledge of culture, like language, is dynamic. Another activity we had to do was about making assumptions, and we had to reflect and share an experience of when we'd made an assumption about a person within a clinical setting. Following on from this, there were some really interesting discussions. The topic about preferred pronouns came up. So the use of the word prefer implying that there's an appropriate alternative to the pronoun that somebody uses. And there was discussion around removing the word preferred from the question altogether and whether this would be more culturally appropriate and respectful. Another really beneficial discussion that took place was about being really inclusive in the way that we introduce ourselves, so making sure to kind of start off by introducing yourself with your gender pronouns to set the precedent among a group that that's normal. My next steps, so with regards to what I've learned about pronouns, I'm going to be updating my social media as well as my email signature to include my she/her pronouns. When it comes to introductions and introducing myself, I'm going to try and make sure I introduce myself with my gender pronouns. With the concept of cultural humility in mind, so I'm committing to creating a log of some kind, acknowledging any assumptions I've made about a person and trying to pinpoint why I've done that and also why my preconceptions might have been wrong. My overall takeaway from the day is to keep learning, and that learning is a lifelong commitment, and it is okay to get things wrong as long as we reflect and try to improve. And also I really want to take this opportunity to encourage newly qualified therapists and students to join CENs. They are a really beneficial way to network, learn new things, and they're just lots and lots of fun. If you have any questions or comments or thoughts you want to share, please drop me a line on Twitter. My handle is @SarahRaben24_7. Look forward to hearing from you.